Hello, everyone, and welcome to the May Links webinar. I'm Lindsay Joseph, and I am the Links Program Officer. Before we get started, I'd like to go over a few housekeeping rules. The lecture will be about 30 minutes long, followed by a Q&A session. We encourage all participants to use the Q&A button located at the bottom of your screen in order to ask questions of the speaker. Participants will be on mute and will be unmuted for the Q&A portion only. The webinar is being recorded and will be posted to linkscommunity.org after the session. I'll now hand it over to Dr. Tom Frieden, President and CEO of Resolve to Save Lives, to introduce today's topic and speaker.
Welcome to today's Links webinar. Resolve to Save Lives is an initiative to aim to save 100 million lives by partnering with countries around the world for three specific programs: the elimination of artificial trans fat from the world, substantial reduction in sodium, and treatment of high blood pressure. Links is an online community and resource sharing platform for people working to improve cardiovascular health around the world. That's a collaboration among Resolve, the World Health Organization, and the Centers for Disease Control and Prevention. Sodium reduction is probably the most challenging of those three areas. Excess salt consumption increases blood pressure and risk of cardiovascular disease. Sodium reduction is a crucially important strategy that can save as many lives as hypertension treatment and at lower cost. Government-regulated sodium food targets with timelines and monitoring are the most successful approach. And I would say that from everything I've seen from my 8 years as CDC director and now nearly 2 years with Resolve to Save Lives, is that Chile's approach to nutrition policy is as good or better than any country anywhere in the world. Their experience with front-of-pack labeling is an inspiring example of a comprehensive and innovative nutrition policy that's part of a multifactorial approach to improving the nutrition environment. Today's presenter is Dr. Marcela Reyes, Assistant Professor at the Institute of Nutrition and Food Technology of the University of Chile. She has provided technical assistance associated to nutrition and nutritional labeling to the Ministry of Health and to PAHO. Currently, Dr. Reyes is co-investigator of a grant evaluating the new labeling and marketing regulation. I'll now hand it over to Dr. Reyes, and let me say for myself that I'm enormously looking forward to listening and learning from this presentation and the discussion that we have afterwards. Over to you.
Thank you very much for the presentation and the invitation and the interest on the Chilean experience. So I'll present this experience. Next, please. Next slide. Explaining a little bit how we got there, and of course the background is that we have a huge problem on obesity, and mostly childhood obesity. So this is part of our numbers, but 25% of 6 to 7 year old children are obese, and if we add to that overweight, it's more than 50% of our children entering to school, either obese or overweight. And this reached to 10% of obesity in children under 6 years old. So it's a huge burden. Next, please. And this is, it has been growing during the last decades, and it's also important burden because it's not evenly distributed. So this is an example of Santiago and some neighborhoods from Santiago, and the most wealthy ones has lower prevalence of obesity than the less wealthy or the low SES. So it's a problem of big magnitude and not equitably distributed. Next, please. And And one of the problems that we have detected that may be linked to this obesity epidemic in Chile is the poor diet we have. And we have different measures of the quality of a diet, but one of the ways to measure it is the dietary share of ultra-processed food. And we have seen in our national survey, dietary survey, that almost 30% of our energy comes from ultra-processed foods that are usually rich in sugar, salt, saturated, and trans fat. Next, please. These are the data for the whole population, but when we look at a subsample of preschoolers in 2016, we can see that the burden is even greater among them, and the dietary share of ultra-processed food reach almost 50% of the energy intake. Next, please. And this is despite several attempts to address this problem. So in the last 2 to 3 decades, the health authorities have tried in different ways to tackle this problem of obesity and bad or poor diets, but they have been focused mainly at the individual level, explaining how to eat better. Next, please. And we know that diets depend greatly in individual factors, but we also know that there is a big box that are related to food environments, that are the physical, economical, political, and sociocultural characteristics that influence how we finally shape our diets. And this would be represented here in this draw that we have at the left part of the screen, like the slope of the, in these drawings. If eating like a heavy weight that we need to push up, we can address it like improving at the individual level the muscle of this person, or we can also decrease the slope and make the carry to the heavy stone easier. So the idea is continue to explain people what is eating healthy and how you could do it, but also trying to help with the healthier food environment to facilitate these healthy decisions. Next, please. So in that term, the new policy is trying to get this structural approach, understanding that if we are obese and with non-communicable disease, we or the framework of the regulation has put the importance of this obesity pandemic in these 4 components of food, so energy, saturated fat, sodium, and sugars. Next. And then the structural approach that has been taken for making healthier decisions is to say that those foods cannot be sold or offered at schools. So cafeteria, school feeding programs, or kiosk won't be able to sell or offer for free that foods. Also, that those foods won't be able to be promoted to children, and they will be labeled very easily in the front of package with a simple message stating that they are those foods have this condition of being high in energy, saturated fat, sodium, or sugar. Next, please. And this is thinking in both the structural approach, so decreasing the slope, and also facilitating or putting more muscle or more strength in this individual, explaining them how to use this labeling. Next, please. So the idea is that natural foods will be excluded of this regulation. So even if a banana has higher levels of sugars, it won't be regulated because it's a natural content of sugar. Next. And this way, it's like we have an approach to processing of foods, and only processed foods will be included in the regulation. And our approach to explain what is processed in the regulation is foods that has been added with either salt, saturated fats, or sugar. So a banana will have will be regulated if they have additional sugar on it, or butter, or something like that, but not even if it's packaged and it has no any additional ingredient adding this natural content of salt, sugars, or saturated fat, it won't be regulated. Next. And the health authorities have fixed limits or cutoff values for the 4 components, different cutoff for solid foods or liquid food, and these are the definition of what will be considered food with high content of calories, saturated fat, sodium, or sugars. Next. So I will talk about every specific item of the regulation separately to explain why we health authorities decide finally implement the law in this way. So the warning labels, the idea is the implementation was based on a very simple label that is like a new paradigm of front of package label, because it's not it doesn't have a lot of information. It's really simple. Next. And it's based on the directive message. So the idea, next please, is having something really clear, a directive message that it doesn't need to be interpreted by the user. So it's not, for instance, the traffic light system. You may have a red, a green, and an orange, and you might need to decide which is more important, or how you will define finally what you need to do in the decision with that specific food. Whereas here, you just have a clear message that is high in and no other extra message. But if you need more information, you can always use the usual or the regular nutrition label. But the idea was that this new labeling was really simple and directive. And this is even when we thought ourselves as very rational. It turns out that we are not that rational when we are deciding what to eat, and we rely a lot in heuristic techniques that are mental shortcuts. So when you need to do a decision that you are doing several times a day as what you will eat, you don't think a lot, or you don't use your reasoning to decide that, and you just decide very quickly. So the idea is that make these very quick decisions really easy, and that's why these are really simple and very visual labels. Next. How it was decided which foods will be high in these key nutrients. It was based on a nutrient profiling done specifically for this regulation. So as I was telling you, it's based in natural food that has been added with ingredients, adding the or increasing the natural level of such nutrients. And next, the actual cutoff were based on on what is found in natural foods. So it was based, for instance, the 10 grams of sugars in solid foods is based on a list of solid foods, and which was the percentile 19th so the 10% of solid foods that have more sugar. How much is that sugar? That was 10 grams. So, and the same thing for saturated fats, calories, and so on. So for liquids, it was based on cow milk. So this cutoff are what the nutrient content of cow milk is. And as I said, the solid foods are based on a list of solid food and the natural content of sodium, saturated fat, grams, and calories. Next, please. And it was established or decided that the implementation will be staggered. So we start in July 2016, but with more, with greater cutoff values for deciding what is high in. And this cutoff has been increasingly more stricter until now that we are about to implement the last phase where we will finally use the cutoff that I showed you before. Next. So regarding the ban of child targeting marketing strategies, this is not just in TV. This is TV, internet, billboards, magazines, food packages, everything. Everything that is child target cannot be used in foods that are high in at least one of the key nutrients. Next. And this is based on the idea that when you see food promotions, you start thinking on food, and it's this is based on the reward system that we have in the brain, and the reward that we feel with foods, and then it's like a stimuli to eat, to overeat. And also the increasing information that shows that children and young children, it's even worse, that are that feel that or they report that foods having a character target to them are more tasteful, and they prefer to buy those foods compared to the ones that don't show the character. So the idea is to decrease or to eliminate this link between having a child appeal and being high in key nutrients. Next. And basically, because here in Chile, as in other countries, we have seen that foods that show have a character, in this case, we are showing data from sweetened sugar beverage, the ones that have character for children or family or childhood in the package have more a higher content of sugar than the ones that don't have the child target character. So here you see that the food environment that we have previous to the regulation was not at all healthy, and the idea was to change that. Next. So part of what happened or is supposed to happen with the regulation is that all these food characters need to leave the package. Next. And lastly, the third part of the regulation is the school food environment regulation. And as I said, it has to do with the school feeding program that is very broadly distributed here in Chile. So the lunch and milk that the childs are receiving cannot have any high-in product, and the same thing happened with kiosk. Next. And this is a very detailed regulation, and you might have a lot of doubt how it was implemented. So this is an article that I can share with you or the interest people, explaining all the details about the regulation and all the complexity of it. Next. So how we got there, this was implemented, as I said, in 2016, will be finally completely implemented now, next month. But the story started like 10 years earlier, in 2007, with Dr. Wawi, that is a big name in the nutrition field. And we are lucky that he's Chilean, and he has been working here together with health authorities and with policymakers, and these particular policymakers, that is Dr. Guido Girardi, that is a senator, and he's a doctor himself. They start working together on this new focus on structural measures beside the individual approach. Next. And after 5 years of discussion, the law was approved in the Senate in 2012, but it was approved in very general terms without knowing what would be the label, what would be the nutrient profiling system, how we would regulate the school environment, without all the details. So it took 3 more years to discuss issues in order to get the decree published in 2015. And this discussion was done by scholars, Professional Association of Nutrition and Public Health, and civil society. Next. Food industry didn't participate in that technical agreements or decisions, but they did participate later when this decree was presented for public consultation, and they were received in order to see how to implement it better with all these complexities that they raised. And so some adaptations were made in order to better address all these complexities, for instance, the staggered implementation. But the technical decisions were not made with participation of the food industry. Next. So now I'll talk to you a little bit about the evaluation that we are doing of this regulation. And the idea is that, of course, what we expect is decreasing weight and or overweight and cardiometabolic problems. But we know that that will happen very late in the evolution of this. So we are looking at proximal factors that can show us whether we are going through in the good direction. So we think these measures are based on food environment. So we will measure the changes in food environment, in knowledge and attitudes and preference about food and the regulation, the dietary patterns, intake of the critical nutrients, and then the very late part of weight and cardiometabolic status. Next. So our evaluation is looking at potential impacts on food at the food environment level and the behavioral level and at the outcome level. Next. Yeah. So at the food environment level, we have been taking pictures to all foods, packaged food available in supermarkets, in main chains in Santiago, Chile. And we are taking pictures to all the faces and looking at labeling, marketing strategies, nutritional content, ingredient list, and so on. And we are also looking at what is being shown on the 8 main channels on TV, from broadcast and paid TV. Next. And here we can tell that implementation was done. So this is data from 2017, so around January or February, so around 6 to 8 months after the implementation of the law. And we could check that 45% of packaged food has at least one warning label. And here you can see it's more or less 3/3. So 1/3 having just one label, the second third having 2 labels, and the third having 3 labels. Next. And even with a small percentage of them having even 4 labels, that it's really challenging to be high in sugars and high in sodium at the first level. But we got some products, mainly from United States products or imported products. And this 45% of warning labels was over 97% of, most foods that need to wear a label were using the label. So we have very good compliance at that aspect. And at the right side, you can see the percentage of being high in calories, sugar, saturated fats, or sodium. So sodium has less than 5% of products were high in sodium, because actually the first cutoff was really high, 800 milligrams per 100 grams of solid food. Next, please. We have been also be able to see the changes at the marketing part, at least in the packages, and see here you can see some images from emblematic product, how the child target character have on, and so even it can be done because they do specifically packages specific for Chile, or some packages are just covered in the part where the character used to be. In the case of Kinder Surprise, it was the only product that need to be eliminated from the market, because it's basically high in and child target itself, so it couldn't be sold anymore. Next. And actually what we have been seeing is a manuscript under preparation, is that the association that was seen previous, the regulation that in the case, for instance, of a breakfast cereal, that we could see that the ones that were a child target were higher in sugar, that relation, that association was gone after the regulation. So now it's the opposite. The ones that have less sugar have a child target strategy. So in terms of changes in the presence of high in food ads in television and TV, this is an example of SSB's ad, and we have a decrease of the proportion of those ads in more than 50% decrease in the post-implementation period, and this is also a manuscript under preparation, but we have been seeing that with cookies and other food groups, how the TV is showing less of those high-in foods. The total amount of food ads has not decreased, but what it has decreased is the amount of food ads high-in food ads. That were the data then based on food environment level. At the behavioral level, we are conducting 2 studies, one following a group of adolescents and the other one following a group of preschoolers and their mothers. Both groups were recruited in the southeast area from Santiago, that is a low and middle low SES area, so not nationally representative, but they behave very likely, they have the same numbers of obesity rates and education rates than the whole country, so we can take conclusion anyway. And we are asking them several questions about diet. We are weighting measuring them anthropometric measures and asking them how they see television and linking that television, watching television with the content analysis of television, and asking also to them what they think about the labels or some specific foods that have the label. So next. What we have been looking on them, here is an example of how the exposure to TV ads, to high-in ad exposure has decreased around 50%, for instance, among preschoolers. So of course, this is divided in the ones depending on how heavily they watch TV. So of course, the maximum, the upper 25%, or the ones that are in the top, viewers or the heavier viewers have the greater impact in terms of that they are decreasing their exposure to high-in food ads to 50% or less. Next. Regarding what they think about the warning labels or how they understand the warning labels, I'm showing here data in blue from preschooler mothers and in orange from adolescents. And so we can see how most of them, almost 100% of them, are okay with the Ministry of Health indicating them which food are less healthy, because we wanted to see whether this was something that was accepted by the population or not. So they greatly accepted it. And these are data from before the implementation, and they understood what the logo means and what that 3 logos were less healthy than 1 logo. So even after before the implementation and the campaign, communication campaign, most people understood what the logo was about and liked the idea. Next. And we are showing them, we are doing several, we are asking them several questions, but here I'm showing just one result when we show them a food, specifically here a juice, that in the pre-implementation period didn't have a warning label, and in the post-implementation period it starts showing it. The preschooler mothers and adolescents understood better, or the proportion of participants that said that this juice was healthy decreased in around 30% compared to the pre-regulation period, making clear that people is understanding greater the nutritional quality of foods on these warning labels. And at the behavioral level, we are also looking at food purchases using Kantar World Panel, that is based in Chile, the main cities of Chile, and not just Santiago as our other studies. And we are linking the information on food that they are buying with nutritional information. So again, this is all under preparation, and I just can tell you that our analysis in sugar, sweet, and beverage is amazingly good. The amount of regulated food has decreased around 20% or more. And this is much greater than what has been seen with the tax in Mexico, for instance. Next. And we are conducting actually studies in other food groups, mainly child target as a breakfast cereal, cookies, grain-based dessert, and so on. And the regulated products of those food groups are showing good changes in the right direction. And we have also conducted qualitative studies at the behavioral level. This is already published and is available for the ones that ask it, but it's open access, so you can take it, download it. And next, this was done a year later, the implementation among mothers of adolescent and preschoolers from different SES levels. And basically, we have seen that warning labels are helping informing the consumers. These are some quotations from mothers. But also a very important finding is that what children are doing, or the role of children, and mostly young children, in driving this healthier decision. So mothers would say us that they need to almost like negotiate with their kids in order to buy something with the logo. So because it's so simple and so visual, kids have been very involved in understanding the logo and in putting pressure to their families, saying, no, one logo, no, or two logos, no way. And even we have seen that the social norm is kind of changing. So children don't feel proud to take a product to the school, either because the teachers have taught them about that, or because the same partners, the other children it's not cool anymore to start eating a unhealthy snack. So a very impressive change that we have seen in those focus groups. Next. Regarding other impact indicators, we were very interested in the industry response, because at the beginning they pulled together in a new coalition of food and beverage from Chile, Ave Chile, and that they start fighting a lot about the regulation, but finally it turns out that the compliance was really good and increasingly in the time. Next. And actually, we have seen a different undertaking of healthy food for a school kiosk, because basically kiosk couldn't sell most of what they were selling in the pre-implementation period was forbidden later. So a lot of undertaking of healthy food, like banana chips, apple chips, start appearing. Next. And they have responded really impressively regarding reformulation. Again, I cannot, we are working on those data, but this is just an example of what food industry is saying, that around 20% of their products have been reformulated. And this is an example with Fanta, that regular Fanta used to be high in sugar. You can see there the logo, but then they reformulate, and now our regular Fanta has half of the sugar that it used to have, and now is not having a logo. And additionally, we have Fanta Zero or Light or so on. Next. And we have seen great, like our preliminary data show great changes toward the direction that we wanted regarding sugars in breakfast cereal, SSBs and dairies mainly, and salt or sodium among sausages, savory spreads, and cheese.
Hi, Dr. Reyes. Sorry to interrupt. We're almost at time. I wonder if we could maybe skip to your concluding slide so we can allow time for questions and answers.
Sure. Next, please. So that was to show that the food industry has used this as a marketing strategy also. Next, please. So we have been recognized all over the world about this regulation. Next. And I just want to mention at the end that this is being thought or implemented in different countries, and that a big fear that we had, that it was World Trade Organization problems, have not longer pursued, and we have no problem at that level. And the last one, please, is just to mention that that this is a package of measures, so it's not just one single measure aimed to decrease obesity and non-communicable disease, but of course, an important part that we feel about this is that it's a package of measures that is mandatory, but of course we understand that it needs to be additional strategies need to be added to that, and because it's on the, it seems to be in the right direction, but of course it won't solve a huge problem as the one that we have. So we are now looking for other possibilities, for instance, taxing those foods or other things. Thank you very much.
Thank you very much, Dr. Reyes. This was a terrific presentation, and really a lot of very important information, very clearly laid out. Understand that this took many, many years for this to come to fruition, and we very much look forward to additional results and impacts being documented. I would ask that those who have questions place them on the, use the question answer format for that. Lindsay, do you want to explain further about how that works?
Sure. If everyone could use the Q&A button at the bottom of your screen instead of the chat feature, then you can type in your question and we can read them out loud for everyone who's on the call. I do have a few questions for you, Dr. Reyes, to get the conversation started. The first is, what work is underway to understand the impact on food supply?
Sorry, can you repeat?
Sure. Just asking what work is underway to help us understand the impact of the food supply.
Under waves? I'm sorry, I cannot, can you reformulate the question? I cannot get it.
Thank you.
Sorry,
basically,
what are you doing now
what are you doing now to evaluate what impact this is having on the food supply? What types of impact evaluation are you doing for the food supply?
Right. We are going to all supermarkets or main chains of supermarkets that are the main sources here to buy food. And we are taking pictures of all of what is available there. So we will be able to see two things. So whether foods have been, packaged food has been reformulated. So one specific food has changed their nutritional content, but we will also be able to look at the entrance of new food, so food innovation. So whether there is new food entering to the market or food that has left the market. So we are doing that, and we are taking into account the best sales food according to data from Euromonitor or Kantar to see whether this, the food supply or what is available is changing, but also whether this is being bought by people.
Thank you, Dr. Reyes. The next question is, how did you address the challenge of industry opposition?
So we are researchers, so we were not there. We are not the policymakers or anything. So we were not really and negotiating with food industry or looking at all the pushbacks that have been done there. We are, but we knew about some of those discussions, and we are trying to. It's not. We like to see the industry response and monitor it, but it's really hard. We don't have the specific tools for that. So we have been conducting qualitative research and looking at the news, so content analysis of newspapers and the websites of the Food Industry Coalition mainly, and trying to understand how they have behaved regarding that. But it's very clear that there was a strong opposition at the beginning, and it has changed a lot. So food industry has, first of all, implement the regulation, and then they have been changing their formulations in order to get rid of the logo, and they have marketed that condition of being free of logos as a marketing strategy, and that's a way to accept the regulation. And actually some of them are even like trying to explain the regulation in other countries. So I think that in those 2-3 years, the reaction has changed a lot, and they have seen an opportunity because, of course, we keep selling, buying food. And so it has been an option to arrive to other markets' interest, and I think now they are taking it as something that is already set and will stay.
Thank you very much. One question, and I've heard this discussed before, is why the selection of the black color as opposed to other colors? I believe you had done some studies to evaluate that, and I think participants would like to hear of that.
Right. The selection, we test red color, red and yellow, and on the other hand, black and white. Why those two combinations? Because they were seen from the literature and from experts in design, and from what people have said that they understood as warning, because the regulation was already framed in a warning type of label. And when we tested both combinations, in packages, the black and white was clearly seen, but I think it's just because there are less packages that use black in their package, whereas the red color is something that is used usually in food packages. But actually the black and white was better, but not impressively better. So I think, at least from our experience, red and yellow could work also.
Thank you. And did you consider positive labels for healthy food in addition to or instead of the warning labels? And this is a question coming from Thailand, which also congratulates you on your very impressive achievement.
Thanks. In the 5 years discussion at the Senate, they consider a lot of different things. Actually, the red light in the traffic light system from UK was the first one. But it was decided finally from the first testing that were done during that time that the easier or the label that was mostly understood was a negative one. And actually there are some preliminary studies showing them there that people doesn't need to reasons for keep eating. They need reasons for stop eating. That were like the main conclusion of those studies. And then they decide to, the law was framed saying warning labels or a label that clearly state that the food is high in this and that. So afterwards, when we did the studies for deciding which label, we were already framed with that, it should be a negative label. But we still have our regulation still allow GDA or health claims. So you could have in a single food the warning label and something that say that is high in vitamins or high in calcium, that is not forbidden.
Thank you very much. And looking to the future, are you thinking about further adjustments to the levels that you used in the 3 phases so far? And related to that, have you been able to stay on the schedule of the phased implementation as initially planned?
Yes, so the final phase is based on the natural content of those nutrients in foods. So that was the gold standard, and therefore it's not thought to be changed. But of course, we have been talking lately about including other nutrients or non-nutrients, for instance, non-caloric sweeteners, that it's a concern that everyone is asking about. And so I think the health authorities are not thinking in changing the late cutoff. And we have been able to be on track, yes. And this is very amazing because this is actually, we have changed government meantime. And I'm very impressed as I think it's very important that this is set with the law and it's not up to governments to change it, because usually in our countries a new government arrives and they change all the decisions from the previous government, and here it was not at all changed and they just follow the schedule, and it talks very greatly about the importance, I think, of this kind of measures to be secure with the law behind and not just the willingness of the health authorities.
Thank you. That's a really important point. I had understood your presentation to say that the law left some leeway for interpretation in the latitude, but was the law specific enough so that it couldn't really be walked back from timeframes or other details?
No, actually the law was not very specific. It was very general, and it was the regulation, I'm not sure how you call that, the act or like the way that you download the law to the reality, that will provide all the details, and that actually could be changed by new health authorities if they wanted to, but at the same time, they didn't do it. So they could have changed the time frame, for instance. Yes, they could. But at the same time, it's amazingly here how the logos are, like everyone really likes the logos. You could see like T-shirts with the logos. I don't know, they use it for different kind of marketing, not just about food, or like TV shows are showing these logos like you are hiring, I don't know, altruism or hiring PT. They have been used like really, it have permeated the society a lot. And actually at the beginning, after 6 months implementation, the AB Chile, the Food Coalition, launched a campaign like mocking about the regulation in the websites, the Twitter and so on. And it was amazing how people react against that campaign. And actually they need to ask for like to say that it was a mistake and so on. So it was like a thermometer to check that people really like the regulation, and that was a big change for food industry, deciding, okay, we cannot fight anymore this, and we need to move on with this, because actually it's very important. So I think that it has been so well taken by the population that new authorities, even if they could change some things, they didn't do it because it won't be really accepted by the population.
Thank you. And last question, and also an invitation to you to add anything you'd like in the last 2 minutes we have. That last comment that there was a large reaction to the food industry, it's quite interesting. That's an unusual welling up of community support for what could be seen as a controversial public health action. Do you have any theory or guess as to what led to that kind of a societal support for this initiative?
Oh, hard to tell. We were very scared about that because here in Chile, the civil society is not really organized. So we didn't have civil society really pushing for this at the beginning. So my guess, but it's just a guess, is that because it was so simple, so easy to understand, and it was so broadly found everywhere, because you can see it everywhere. Like we didn't really need a campaign for this. We had it, but it was very short. But everyone was aware of it, and they kind of understood some, like it was seen in the qualitative study, like they kind of reveal the nutritional quality of some foods that they thought that it was okay. So it was so simple and clear that people really, even if they did not look for it, they really appreciate. And because people reaction, I think that food industry just needed to adapt to that, and so they tried to keep fighting, and they understood that they couldn't do it because the people reaction was against them. So they understood, like there was a switch there, I think, based on people's reaction. And I really would like to highlight the simplicity of it, because it seems that people reaction also is very driven by children reaction. So when you talk, people must decide which kind of label using, it's very important to think that you should target children. If children understand what we are talking about, and it's like the pester power, but in the opposite direction, we know that children drives food purchases and every kind of purchase. So getting to children, it was really smart, and it was not thought maybe carefully, but it was really successful, I think, at that point.
Great, thank you very much. This has been a fascinating presentation, really valuable. It will be posted on the Links community website. I thank everyone for participating. Remind you that our next webinar will be June 20th from 9 to 10 a.m. Eastern Standard Time, presented by Yolanda Richardson, Kira Beresai, and Gianella Severini on behalf of the Global Health Advocacy Incubator concerning policy and legal considerations for regulating trans fat. We heard really exciting experience from Chile, emphasizing a simple, comprehensive policy that is implemented quickly enough, but methodically enough, so that it can withstand industry opposition. Thank you so much, Dr. De Reyes, for your presentation and the work of you and all of your colleagues in helping to show the way for healthier nutrition globally. Thank you all very much.
Thank you.